Good afternoon. I'd like to welcome everybody to this pep talk this afternoon, April 6, 2024. As a reminder, please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk. So please show your beautiful faces in the video. A reminder after the pep talk is to take the online learning co-evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. I have placed the link in the chat box. Another reminder, obtaining 25 instead of 50 starting 2024, 25 OLETE certificates is enough to entitle one mentee to a voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your video, turn on your video and show your beautiful faces. Okay, ready? 1, 2, 3. Again. Let's repeat it again. I didn't. Okay. Show your beautiful faces. Okay. 1, 1, 2, 3. Ayun. 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. The contents of the pep core course are shown here. From October 23, 2021 onwards, I've been tackling health disorder here, sample courses, and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. But to tell you honestly, we're now on our 3rd year and we will be completing our 3rd year on May 15, 2024. My pep talk today is entitled, Does Biopsy Make Cancer Spread? The empowerment objective is for the lay people to have an essential understanding on whether biopsy can make cancer spread as part of their health management. The contents of this pep talk will be the following. What is a biopsy? What are the different types? What are the benefits? Does biopsy make cancer spread? And what is the origin of the fear of spread of cancer in biopsy? And what are my advice on the issue? What are my practices related to the issue? Disclaimer, the contents of this pep talk will consist of my thoughts, perceptions, opinions, and recommendations, or TP or Rs, ORs culled from the experience of personal experience as well as from the experience of other people. Let's start with the first topic. What is a biopsy? We frequently hear this term biopsy. A biopsy is a procedure that usually removes a sample. I like to emphasize the word sample of tissues, cells, fluid from the body. And then this sample is examined by a medical pathologist, usually through a microscope. Kaya tinitingnan ito sa microscope by a pathologist. The objective of the biopsy is to come out with a more definite diagnosis of the presenting medical disease or condition prior to instituting definitive treatment. So usually gusto malaman kung talaga ano ba talaga ang diagnosis. As much as possible, kung pwede, as high as 99% sure. Kung minsan, pwede na yung 90%. No? Pero kung less than 90% ang certainty, usually, binabiopsy, okay, to get a higher degree of certainty in terms of the diagnosis para maumpisahan yung proper treatment. So this biopsy is usually done after a clinical diagnosis. Ang diagnosis kasi consists of clinical, yung una, yung pagtingin ng doctor sa pasyente. So this is based on the symptoms, anong nararamdaman ng pasyente, and physical exam based on what the doctor will see on examination of the patient's body. And also, the diagnosis is usually gotten also from other laboratory diagnostic tests like CT scan, ultrasound, etc. Okay. So if these are done, clinical diagnosis and then laboratory examinations done, pero hindi pa sigurado yung diagnosis, then a biopsy may have to be done, okay, to be more certain of the pre-treatment diagnosis. A biopsy is a procedure that usually removes a sample of tissue, cells, fluid from the body, and then this sample is examined by a medical pathologist through a microscope. So I said sample, okay, usually removes a sample. So not usually hindi yung buong organ, buong tissues, usually a sample. And then I would like to emphasize the word usually. Pero there's a type of biopsy in which the whole mass, not the whole organ, but the whole mass is removed like, to be examined. Okay. So there are several types of biopsy of masses. Number one is needle aspiration. Okay, this is only a sample is gotten. Then cutting needle biopsy, again, a sample is gotten. And then incisional biopsy, only a sample again. Punch biopsy, sample. Excision biopsy, ito yung exception to the definition of the biopsy. Okay. Usually when you say excisional biopsy, yung buong bukol ang tinatanggal and pinapa-examine. So that's what is called excisional biopsy. But the rest are usually sample. Okay. Needle aspiration, cutting needle, incisional, and punch biopsy. So sample can be gotten from tissues of masses, mga bukol, and organs. Yung mga, let's say, kidney. No? Sample from kidney, from the liver, okay, pwede rin. Okay? The other source of the samples will be from the mga bukol-bukol sa katawan. Okay? Then, so aside from the tissues, meron ding cells makukuha to be examined and also the fluid to be examined. So this is an illustration of a sample from organs with a medical condition. Example, kidney biopsy, liver biopsy. Pwede rin, na? Okay. So, kukuha lang ang sample using a needle like this, biopsy needle, itutusok dito sa kidney, kukuha ng sample, and then papa-examine. This is a sample of cells. Cells naman kinukuha rito from a needle aspiration biopsy. Okay. So, ito yung bukol. with a syringe, with a needle, itutusok, and then i-aspirate, ihigop, no? Okay. So, inihigop ito, and then after that, pag may nakitang sample dito sa needle, sa hub of the needle, ibig sabihin may nakuhang sample na, so tatanggalin na itong hiringilya, okay? Then after that, i-detach yung needle from the hiringilya, and then yung ikakabit ulit, lalagyan ng hangin yung hiringilya para i-flush out yung sample dito sa may karayom. No? Okay. So ito yung sample. Ito hiringilya, and then i-flush out yung sample na hinigop, no? Sample of cells hinigop dun sa bukol. No? So ito yung makikita yung sample of cells that will be examined by the pathologist. Now, a punch biopsy naman, no? Ito yung itsura, parang using a punching instrument tool, no? Kukuha lang konting sample. Okay? Usually this is done on the skin surface. Okay? Ito, kukuha lang konting laman, no? Using a special instrument like they call it punching instruments, no? Okay. O kung minsan, pwede ding punch yung agatin lang konti. Ito sa cervix naman, hihilahin lang konti kasi usually marupok na rin ito, medyo friable, kaya madaling tanggalin. No? Okay, this is another example of a punch biopsy doon sa cervix. Sa mga, kung may cervical cancer, usually punch biopsy ang ginagamit. Now, the cutting needle biopsy naman, this is a special needle that has a cutting edges. Pasok dito sa bukol, pagpasok nito, ikakat yung konting tissue, then pag isasara ito, makukuha na itong sample, then ilalabas itong karayo, itong malaking needle. No? So ito yung sample na i-examine ng pathologist. So this is a sample of tissues from masses using the cutting, o ang commonly used term ngayon, they call it core needle biopsy. Okay. So, difference between aspiration and core needle. Kung aspiration, hiringgilya lang, okay, with the needle, then ito iba biopsy, tutusok doon, kukuha ng konting sample, ito yung mga sample. Core needle naman, mas malaking karayom, no? Papasok again doon sa mass, and then kukuha ng sample. Okay? So ang kaibahan nito, mas malaki konti yung core needle compared to the needle aspiration. And then here in the core needle, you usually have a special instrument. Dito sa needle aspiration, usually simple hiringgilya lang and yung isang karayom, no? Gauge 22, gauge 19, ganon. No? Now, as to the difference between incisional and excisional biopsy, yung incisional biopsy or the other term is section biopsy kasi isang section lang, isang piraso lang, ito yung buong bukol, konting piraso lang, a sample will be gotten. No? Tatanggalin lang ito, then papa-examine. Whereas when you say excision, tatanggalin yung bukol, the whole mass, then papa-examine yung buong bukol, okay, through the microscope by the pathologist. So incisional versus excisional biopsy. Okay. Another example of incisional biopsy and excisional. Incisional, eto, kapiraso lang. Excisional, yung buong bukol tatanggalin. Now, sample of fluid that will be biopsied. Example, kung may tubig dito sa chest cavity, pwedeng higupin ito with needle, ito, okay, showing the needle going into the chest wall, higupin, and then yung fluid na makukuha, i-examine sa microscope by the pathologist. So that's what is called biopsy also. Again, doon sa tiyan naman, kung minsan may maraming tubig sa tiyan, no, hindi malaman kung saan galing, baka may cancer, gano'n. So, pwedeng ipasok din isang tube, isang needle, higupin yung fluid, then i-examine itong fluid for mga cancer cells. No? Okay. So, biopsy can be done on organs like kidney, like liver, and or tissues with or without masses. Okay. In those without masses, it is done to determine the non-tumor disease present. Pero pag may masses, there's a question whether it's cancer or not, then it is done to determine if a cancer is present or not in that mass. So in this pep talk, I would like to focus on biopsy for masses and answer the question, does biopsy make cancer spread? If the mass being biopsy turned out to be cancer. Kung tinusok yung binayopsy yung bukol na possible cancer, okay, will it, kung lumabas ay talagang cancer, will that biopsy make the cancer spread? Okay. So before discussing the issue on what does biopsy make a cancer spread, let's look at the benefits of the biopsy first. So what are the benefits of the biopsy? So to know exactly what kind of a buccal or a mass is there. So yun ang pinakaunang goal. So is it cancerous or not? If cancer, what is the specific type? Sometimes we want to know what is the specific type more than just saying it's cancer. A biopsy may be resorted to if the clinical examination based on symptoms and physical examination and other laboratory examinations cannot give a definitive diagnosis. Kung sigurado na yung diagnosis based on clinical examination and laboratory test, kuminsan hindi na kailangan yung biopsy. Pag hindi pa sigurado, there's a need to be more certain, then a biopsy will have to be done. Overall, the objective of the biopsy will be to guide the treatment. Kung anong gagawin exactly to a patient with a bukol. So the question is, does biopsy make cancer spread? For a long time and up to this time, there have been rumblings about the possible dangers of cancer spread when having biopsies, for example, in breast cancer or prostate cancer. Maraming umaayaw sa biopsy, natatakot sila because of this hearing that it might cause spread of the cancer. So people are afraid of having a biopsy for tumor which can be cancer because of fear of spread of the cancer. So the question is this a myth or a fact, a reality? Totoo? Is it rare or is it very often? So these are the basic questions that we have to answer. So the fear issues are twofold here. Number one, it's either an issue of cancer seeding or cancer spread when a biopsy is done. I will differentiate these two, cancer seeding and cancer spread. When you say cancer seeding, it's usually obtained during a needle biopsy kasi tinutusok, no? Okay. And then when you say cancer seeding, it refers to the occurrences when the needle inserted into a tumor, okay, during a biopsy dislodges and spread the cancer cells. It is sometimes called the needle trap or trap seeding because of cancer cell grow along the needle trap. Example, dito sa picture nito, sabihin natin, ito turn out to be cancer, pinasok yung karayom, tinusok. So pag tinusok yung bukol with the karayom, contaminated na yung karayom. Pag tanggal, siyempre, mako-contaminate ito yung sa skin, yung sa normal tissues. No? Okay. Ganon din dito sa kidney. Kung may cancer dito, pwede mag-contaminate yung sa labas sa kidney, yung sa balat, yung sa muscle, no? Because contaminated niya yung karayom, no? So this is the fear of aspiration, biopsy, needle biopsy of cancer, yung seeding, okay? Because it might cause recurrence, okay? So aside from the needle biopsy, the other situation in which there is a potential seeding or contamination is in patients undergoing incisional biopsy as one cuts through the cancer tissues to get a sample. Ito, kanina present ko, pag incisional biopsy, dumadaan tayo dun sa cancer And then yung instrument na dumaan dyan, makocontaminate yan. So baka mag-spill dito sa balat. No? Okay. So cancer cells may spill over, it may seed or contaminate to the adjacent normal tissue, and the instruments used to close the skin overlying the cancer where incision biopsy was done may also cause seeding and contamination. So yung instrumento na ginamit pagkuha ng sample, okay, it might cause contamination of dun sa hiwa, dun sa balat. No? Okay. Kung excision, halos wala. If you have a good margin, you don't cut through the tumor, dito ka lang sa side, no? So you're not causing contamination, you're not causing seeding. No? It is true that biopsies, such as those using needle inserted through the skin, and the incision biopsy that needs prior skin opening to reach a cancer tumor can cause seeding or contamination of cancer cells in the needle trap or on the skin incision. But the question is, how frequent does this seeding or contamination cause ill consequences such as local recurrence? Kasi pag nag-contaminate, pwedeng mag-recur yung do sa contaminated area like the balat. No? Okay. So what does the research say about biopsies causing and spreading cancer? Several studies and reports confirm that tumor seeding and contamination with needle and incisional biopsies can occur, but rarely do they cause ill consequences such as local recurrence and spread to distant sites. A 2008 review in this particular journal showed that needle tract seeding occurred in 2.7% of liver cancer biopsies. So talagang meron, pero 2.7. In a 2015 report naman from the British Journal of Urology, researchers found that the incidence of needle tract seeding was low, less than 1% when they do prostate biopsies. In a 2013 study in endoscopy, researchers found no difference in cancer recurrence in 256 patients with pancreatic cancer who did and did not receive biopsies. So this study showed walang difference. In the later 2015 study in the gut, the same researchers found that biopsies were not associated with an increased risk of dying, okay, with pancreatic cancer kung ma-biopsy with needle. And another study, 2019, urology, found that the core needle biopsy was safe and effective in 42 patients with bladder cancer, and that seeding did not occur after 28 months of follow-up. Okay. So there's may mga meron, may mga wala, no? Okay. So the conclusion here, overall, while it is not impossible theoretically, kasi pag tinignan mo yung mechanism of doing of the procedure, while it is not impossible for needle seeding and contamination in the incisional biopsy to occur, it is rare. Rare lang naman. So, pwedeng mangyari pero rare. So, spread of cancer naman, kanina seeding, let's talk about spread of cancer. A common patient concern is that biopsies may cause microscopic cells from cancers to metastasize. Metastasize is the medical term for spread to other parts of the body. In other words, the concern is, do biopsies cause spread of the cancer to distant organs and tissues? When you say distant organs, yung sa malayong lugar, no? Such as, let's say, kung may breast cancer, pupunta sa bone, kung sa prostate naman, kung pupunta sa lungs, and these are examples of distant metastases, okay? And eventually cause death. Okay. So there are reports on this phenomenon. Again, the incidence is said to be rare. Okay. So I cannot tell you honestly, wala, pero it's rare. No? Okay. So these are the studies. Okay. In a 2015 study, pancreatic cancer patients who received a biopsy had a better outcome and longer survival than patients who did not have biopsy. Okay. In a 2013 study naman, Okay, they found that those with pancreatic cancers in the Mayo Clinic, they found no difference in cancer recurrence. Okay, so there are reports showing concerns of spread of cancer caused by the biopsy. Example, for fear of spread, a needle biopsy usually is not used in diagnosing testicular cancer. Instead, if a surgeon suspects testicular cancer, the testicle is removed. Ito yung excision. So, ito yung isang report na mga urologists saying that pwedeng mangyari, mag-spread yung cancer if you biopsy a testicular cancer. Okay, that's why they would rather remove the entire mass already rather than doing a needle biopsy. Now, the same reasons given for fear of spread, pupunta sa ibang lugar. Okay, so by specialists when they do the biopsy of the ovarian cancers, yung mga tumors that will turn out to be ovarian cancer, if they biopsy it, baka they fear baka mag-spread. Ganon din sa thymus. No? So there are certain organs that are notorious for this. No? So soft tissue sarcomas is another situations. Okay. The National Cancer Institute has also addressed this concern in a statement of common cancer myth and misconceptions. It does not say totally zero, but it admits, inaamin nila that there are cases, but bihira, extremely low. So this is their statement. The chance that surgery will cause cancer to spread to other parts of the body is extremely low. Following standard procedures, surgeons use special methods and take many steps to prevent cancer cells from spreading during biopsies or surgery to remove tumors. For example, if they must remove tissue from more than one area of the body, they use different surgical tools for each area para hindi siya mag-contaminate. Kaya gumagamit ng, let's say, nag-opera sa isang area na baka cancer, that they have to operate on another area, they use different instruments, bagong instruments, clean instruments. So overall, so what's the answer to this issue? Based on the findings, the likelihood of tumor recurrence and spread as a consequence of the biopsy procedure appears very low. Hindi naman zero, very low. But nevertheless, vigilance for this potential complication is still advised. So anxious patients who may inquire about these possible potential complications can be reassured that although it does occur, the clinical effect appears negligible, kasi rare, and the biopsy as a cause of the disease recurrence and spread appears very, very rare, not often. Okay. So what is the origin of the fear of spread of cancer in biopsy? Bakit even in the Philippines, bakit natatakot yung mga tao? This is not only true in the Philippines at all, but this is true all over the world. The fear of spread of cancer in biopsy. So the scenarios is like this. So a few months or years after the biopsy procedure, the patient dies of disseminated cancer. Kumalat na. Okay, so yan ang observation ng isang relative. So, but the reality is that at the very start or at the time of the biopsy procedure, the cancer is already disseminated or far advanced, hindi lang napupuna. Okay, so after the biopsy, it led to the early death. So relatives cannot accept this reality or relate, associate, or blame the death to the biopsy procedure. Okay. So, yan lang na-observe nila, pero hindi nila alam na during the time of the biopsy, talagang malala na. Okay? So, however, as mentioned above, there are reported cases in which biopsy procedure causes spread to distant organs, disseminated diseases, and cause death. But these are rare. Ang ina-emphasize lang dito, these are rare. No? Hindi man always. No? So, what are my advice on the issue? Number one, take note of the possibility, but also take note of the rarity of the complications of biopsy. Then weigh and balance the benefits and risks of biopsy and then make a decision. Kung mataas ang benefit that you're going to get from the biopsy, go for it. Okay? Kung maliit lang yung risk, like very rare, pwedeng ma-over yung benefit will overweight the risk. So sundan na lang yung benefit. Then ask the physician for advice on the indications and benefit risk weighing of the biopsy. So you have to ask the doctor, ano bang indications ng biopsy? Kung sigurado na, sabi mo, pwede na bang hindi na pwedeng wala ng biopsy? Okay? Or if there's a biopsy, can you ask them, ano ba yung benefit and the risk? No? Now, the other advice is consider other options aside from biopsy and other types of biopsy in getting to a more definitive diagnosis prior to definitive treatment. So merong mga other options that might be available like an excision biopsy at tanggalin ng buo, ng bukol, pero dapat maliit lang, no? Yung bukol, no? Or other diagnostic tests, no? Na mga imaging procedures na walang the non-invasive, hindi siya biopsy procedure. Then the other advice here is to take note of the usefulness of the benefit of biopsy in cancer treatment because it can help prove the existence of cancer and then help plan of the treatment. Ito yung benefit niya. No? So you just have to weigh it against the risk. Under certain circumstances, however, take note also that treatment can be instituted without biopsy confirmation of cancer. Okay. So you also have to take note that merong instances you don't need the biopsy, diretso na sa treatment, sa gamutan. Okay. Situations in which biopsy can be skipped, pwedeng hindi gawin. Okay. Physicians are quite certain of the cancer diagnosis based on clinical examination and imaging studies and other tests that biopsy may not have to be done. Kung let's say 99% na yung certainty ng diagnosis by the doctor based on this examination niya at saka mga tests, na, okay, so pwedeng hindi na i-biopsy, diretso na yung sa gamutan. Now, the other situation is kung masyadong malalim yung tumor, okay, which is difficult to have a biopsy, then it doesn't have to be done. Then tumors with track records of high chance of seeding and spread, such as ovarian cancers and thymus tumors, okay. So you don't do biopsy on this kung mayroon siyang track record na mataas ang chance of seeding and spread, hindi dapat gawin. When biopsy will not alter the treatment, example, an excision or white excision has to be done regardless of whether cancer or not. Kung may bukol siya, cancer o hindi, pwedeng tanggalin na lang lahat, no? Without doing a biopsy, tanggalin muna and then have it examined after matanggal. Then kung merong emergencies na related to tumor, let's say sabihin natin may tumor sa intestine, no? Tumor sa intestine at nagkakos ng intestinal obstruction or pumutok na, no? You don't have time to do endoscopy anymore. So diretso na, operahan na. Okay? No time to do biopsy. Okay? Then so operahan na yung pasyente and then during the operation, that's the time malalaman kung talagang kung ano yung sitwasyon, kung cancer o hindi. No? So these are the situations in which biopsy can be skipped. Now, what are my practices related to the issue? I do biopsy only when strongly indicated and after considering other options for a definite diagnosis and also after weighing the benefit and risk of the biopsy. So my indication for biopsy, to repeat it, I need to come out with a more definite diagnosis of the presenting medical disease or conditions prior to instituting a more definitive treatment. And then I need to be more definite in diagnosis after clinical exam and other diagnostic tests. Okay. So ubusin ko, i-exhaust ko muna, especially yung clinical exam. Na? Okay. So dapat meron akong physical exam, huwag lang ako magre-rely sa mga diagnostic tests, and then come out with a decision kung kailangan pa ng ng biopsy. So, I usually choose a biopsy option that will avoid the risk of seeding and spread as much as possible. Example, I can do an excision biopsy without cutting the tumor and with a good margin. So that's my another way of trying to avoid the side effects of biopsy. And then I follow these guidelines, which I mentioned earlier, in which the situation in which biopsy can be skipped. Okay. Okay, so I think that's the last slide for this lecture. So in summary, I have discussed the following: what is a biopsy? What are the different types? What are the benefits? Does biopsy make cancer spread? What is the origin of the fear of spread of cancer in biopsy? And then what are my advice and my practices? Takeaway in relation to patient empowerment: be always in touch with reliable medical information on whether biopsy make cancer spread. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, kapangyarihan, to gain greater control over decisions and make the better decisions on whether biopsy can make cancer spread as part of your health management. This ends my pep talk today. Does biopsy make cancer spread? I hope I have empowered you to have an essential understanding on this topic as part of your health management. Before we go to the QA, question and answer portion, reminder, please take the online Learning Cum evaluation test exercise for mastery of learning and have a certificate like this shown here. The link has been placed in the chat box. Obtaining 25 latest certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. And then please type in your feedback in the chat box during the open forum. And before we adjourn, let's now have a group picture taking before we start the question and answer and interactions. Please show your faces in the video now. Okay. Ready? 1, 2, 3. Let me save this first. Okay. So the floor is now open for questions, comments, sharing of experience, and others, or consultation. Basta may clue lang. Okay. How many have undergone biopsy before? Si Susan, sino pa?
Yes,
Susan,
I did.
yes. Yeah. Sino pa may biopsy? Okay. So, and would and Susan, after hearing this lecture, are you ano na? Nag-regrets ka? Na-biopsy ka?
No, no need to regret. It's already there. Anyway, I hope you don't mind. I want to ask. Uh, I underwent 2 kinds of biopsies based on your lecture. One is core needle, and the other one is when you remove when I underwent mastectomy, right? That's also biopsy. You remove the entire breast. Is that also biopsy? Then examined it.
Dali lang, Susan. Sandali.
Yes.
Again, sige. Can you hear me?
Yeah, I can hear you.
Yeah, okay. I can hear you
Uh,
now louder. Can you repeat your kasi nawala yung sound
yeah,
ko.
yeah, I can hear you loud and clear.
Yeah.
Okay. What I'm trying to say is that before I underwent mastectomy, I had core needle biopsy.
Okay.
So is it is it right for me to conclude that I underwent two biopsies?
Is it right?
Yeah, for me to conclude that I underwent two biopsies.
Okay. The word is probably the right word is not right, but it's indicated. No? There's a reason for doing it. No?
Okay.
Okay. So because there are instances in which it's difficult to be certain about the diagnosis. Sometimes it has to be repeated. No?
Okay.
Okay. So
So it was repeated. How
yeah,
is that? I mean, the diagnose, it is difficult to diagnose. So that's the reason. Although the result of the corneal biopsy still indicated that there was a mass or a tumor,
yeah,
and the last thing we did was to remove the entire breast so it
yeah,
doesn't spread. But if there is cancer, it wouldn't spread to
yeah,
other parts of the body. That's
yeah.
that's that's the right. Did I think of it right or something?
Yeah.
Tama ba yun?
Basta may
Okay.
basta when you say indications, no, it's really needed for one reason or another, no? I mean,
Okay.
when you say for one reason or another, the kasi the doctors is not perfect, medicine is not perfect, no? So what there are areas of uncertainty, no? So if the doctor decides that it's better to be more certain before we jump into the treatment right away, no? So he will say better to do the biopsy first, no? Or minsan i-repeat pa nga. Kasi hindi, with the first, sometimes a biopsy, when you do one biopsy doesn't always mean that you're going to get the answer all the time. Okay? Kasi sampling lang yan eh, sampling, no? So sometimes the biopsy will not tell you the right answer, the correct answer, then you may have to repeat, no? But it now depends on the physicians handling you, yung clinical judgment niya. Okay? Kaya importante papasok yung wisdom, expertise ng doktor mo, no? And
Mhm.
also yung ano niya, clinical eye niya, yung mga based on examination sa iyo, kung anong based on this experience, ano ba ang common, no? What is the usual scenario, no? Ganon. Okay?
Okay. Uh, one last question, Doc. I hope you don't mind.
No, I don't. Okay.
Okay lang. Oo. Of course, as a layman, I tried to read the pathology report. Of course, I couldn't understand it.
Okay.
What is it in that pathology report that indicates that there is cancer possibility of, or there is cancer? Kasi uh, ako naman, I was curious, ano ba itong mga terminology nila? Which of the terminologies there? Because they will not, I noticed, remember I had two cancers, no? Noon, I didn't mind it when I had thyroid. But now that I had the findings of breast cancer, which fortunately, as you said, no clinical evidence of recurrence, no? I'm just curious, what what line or something in that report would indicate that there seems to be that there's a red flag. Sige.
Okay, ganun nga for everybody. Tandaan natin, medicine is inexact. It's an inexact science, na? Okay, we can never be 100% sure of anything, even with the best of the doctors, the best of equipment, no? Okay, so that's one point. The other thing is, because of that, you notice that yung mga when you're talking about reports now, no? Okay.
O mga terminology nila.
Terminologies. Okay. So based on that premise, no, nakikita mo yung mga kuminsan, yung mga doctors, when you do a needle biopsy, they put their suspicious, the word suspicious, suggestive, no? So you have encountered those terms, no? So when they use the word suspicious, suggestive, it shows, it illustrates that they're not 100% sure also, no? Okay. So, but that's a reality, no? That we accept that in medicine, no? Okay. And you, the lay people, should also learn to accept it, no? Okay.
Okay.
Now, if they say carcinoma, okay, very definite na siya. Okay. So that's cancer. Okay. Or if they use the word cancer. But if they say suspicious or suggestive, hindi pa 100, hindi pa 100. Although there's no such thing 100, 99% sure, no?
Oh,
Pero pag sinabi niyang okay, wala nang the word suggestive, no? Sinabi niya invasive ductal carcinoma, no? Okay, yun na yun, 99% na. And then it's really up to yung clinician. When I say clinician, no, hindi na yung pathologist. Yung clinician like me, I treat patients, I interact with patients. I correlate it with your findings, yung sa examination ko. No?
yeah.
Kasi yung pathologist, they just examine yung tissue, yung specimen lang. No? Yung kami, clinicians, we examine your entire body. No? We correlate. No? Ganon. No? Okay. Eh, sa iyo naman, okay, trying to recall your case, you remember may atypical cells, atypical something, no? Yung atypical is also uncertain words yun eh. There are some words that they use which connote uncertainty, no? Okay.
Okay.
Okay. So ganon, no?
Now
Okay.
I am enlightened.
Yung sa thyroid mo, walang problema. Very definite sila, papillary, di ba?
Yes. Yes.
So, but there are instances in which the pathologist also not sure sa mga thyroid, no? Kung follicular, papillary, o ano, no, iba-iba. Okay?
Yes. Okay. Thank you.
Okay. So we just have to balance and then see kung ano yung, when you say indicated, the doctor should explain everything to you kung anong basis niya for telling you you need a biopsy. Okay? Okay. Any more? Any more questions to be asked? Wala bang magtatanong? Mag-share ng experience? Si Senny Cabral, welcome back.
Dok, yung unang nagpa-opera po ako sa bukol ko sa breast, yun binalipsi po. Tapos nalaman nga po, cancerous na stage 2. Kaya nagpa-check up po ako sa inyo noon, nag-decide na mastectomy na nga po yung Tapos last 2020, Dok, 21, nagkaroon ako ng parang bukol dito sa may tuhod. Ngayon, ang sabi ko, pina-opera ko nga po, tapos pa-biopsy. Kaso nung pag-open, Doc, fluid ang lumabas. Wala na daw iba-biopsy. Tsaka alam naman daw po ng doktor na hindi naman siya cancerous.
Okay.
Na
Anong tanong mo?
Yun lang po, na ko na yun nga po, sa biopsy. Tapos pina-repeat nyo yung biopsy nung hospital na una kong pinag-anuhan. Parang breast panel, Doc.
Okay. So, okay. I will, yung isa sa tuhod, yung isa sa breast, no? Okay. Yung sa tuhod, nung inaspirate sa tuhod mo, fluid.
Hindi siya inaspirate, Doc, talagang hiniwa. Dahil nalaman lang po na fluid nung pag-open, Doc.
Okay. So, hiniwa.
Ang pumunta na po yung
Okay. Yung, hindi siya na ultrasound, na x-ray bago siya hiniwa.
Hindi po, Doc.
Yung sa tuhod mo, sa joint,
Opo, sa labas lang naman po, sa front ng tuhod.
may bukol, bukol.
Opo, parang ano lang po, ngayon ano ko lang po doon sa center sa amin. Yun nga po. Nung pag-open, pumutok po dahil fluid daw ang laman.
Okay. O sige, kasi yung mga, di ba sabi natin, may mga bukol, pwedeng solid, pwedeng cystic. Pag cystic, may fluid. Okay? Pag yung fluid, kadalasan, benign siya, hindi siya cancer. No? Okay. At kung minsan, pwedeng i-aspirate lang yon at mawawala. No? Okay. Kung na-aspirate yon, fluid na kuha, no? And then kung ang thinking ng doktor ay malamang benign, hindi na ipapabiopsy yon, no? Pwedeng hindi na, no? So pero pag solid siya, kadalasan binabiopsy siya, no? Okay. Okay. Yung sa breast mo talagang solid siya, kaya biopsy and then turn out to be cancer, and then we did a mastectomy na, di ba? Okay?
Thank you, Doc.
Sige. Pero hindi ka nag-aalala kasi may mga pasyente na ayaw magpa-biopsy kasi natatakot sila, di ba?
Hindi naman po.
Natatakot baka mag-spread, gano'n. Marami diyan, no? Okay.
Kasi
So,
pag alam na may cancer, Doc, baka mamaya nga may lumipat na sa ibang parte ng ano.
yeah, yan ang concern nga nila, no? Kasi marami silang naririnig kasi yung after the biopsy, maraming namamatay kagad na maaga, no? So ang real story niyan is during the time of the biopsy, kalat na talaga, no? Okay. Okay.
Thank you, Doc.
Okay. Any more? Any more wants to ask questions? Free consultation, short. Miss Aloy. Aloy is first timer sa atin. Aloy, nakapag-attend ka na Aloy. Miss Aloy. Okay. Hindi nakikinig. Any more? Okay. Okay, Rose, meron kang tanong? Rose Bio. May tanong ka? Wala? Ellen? Anybody? Wala pa. Okay. So, last call for questions. If you don't have any questions, we'll call it a day. O meron pa? Maaga pa. Maria Husta, kumusta ka na?
Okay. Negative na ho.
Negative na. Okay.
Negative na.
Yung sa
Ako
mother,
ho noon,
hindi sa mother mo, hindi nare-recall ko, we didn't do biopsy anymore, no?
no more ho kasi ano na si
Obvious na
you
di ba?
obviously. Opo. Ako ho yung when you removed my papilloma on the tongue, you did excisional biopsy. You removed it, we had the biopsy, was nothing. Yun ho. So that wala.
Yeah.
There.
Okay.
And the surgeon, the dental surgeon, I went to didn't want to touch it because she was afraid. Kasi hindi naman siya dental surgeon, ano lang siya dentist. She was afraid kasi sabi niya baka kumalat daw.
Baka kumalat.
So, oo, ay naku, baka kumalat yan if I do something. So, sabi ko, okay, I'll go to a real surgeon. I'll go to a real surgeon. I went to Dr. ROJoson. Ayun, nothing.
Yeah. So that's an illustration na kahit na dentist, na yung mga nasa medical world, no? So they fear na kumakalat pag ginagalaw, no? Okay. Pag kumakalat. So, but we just have to clarify it, no? Ako, I'm not saying totally zero naman, di ba? No, but if you ask other doctors, sasabihin nila, ay, wala yan, wala yan. No, but may mga evidences na meron, pero rare lang. So we just have to balance. No? Okay.
Yeah.
Okay. Last call. Wala nang magtatanong.
Ay, Doc, may i-share some kind of some little question din po. Si
Sige.
Marian to, si Alo
Alo.
Vera. Yung nakapag ako sa'yo, teleconsult dito sa ko, if you remember, sa thyroid ko.
Thyroid.
I-share ko lang about din sa yung papa ko kasi lung cancer.
Okay.
Year 2000, mga 20 years ago, namatay na siya sa cancer.
Mhm.
Ang nangyari sa kanya kasi, nung nakita sa x-ray na may mass yung lungs niya, dinala siya ng Cebu, pinabiopsy.
Mhm.
Ngayon, ang pinagtataka ko kasi, pagkatapos niya mabiopsy, papunta sila ng Cebu, okay pa yung katawan niya, super liksi pa niya. Yung pagkatapos ng pag-biopsy niya, pag-uwi niya ng Bohol, hindi niya na maigalaw yung left side niya.
Okay.
Hindi na niya maigalaw yung left side ng katawan niya. Tapos, nung pumunta siya sa bahay, nagtaka ako, hindi niya na right side pala kasi kanan siya. Uminom
Okay.
siya ng kape. Pag inom niya ng kape, hindi niya na ganun yung cup. Siya na yung lumalapit. So, meaning ba doon, nung pagka-biopsy, nag-spread or kalat na talaga yun? Na lang, lumakas lang yung mga cells.
Okay, mahirap sabihin. Pero anyway, right after, gaano katagal yung nangyari after the biopsy? Pag uwi niya sa Cebu, 1 day lang? From Cebu to Bohol?
Oo, 1 day lang po.
1 day.
Pumunta sila ng mama ko. Po?
Hindi stroke?
Hindi po stroke. Pagka-biopsy, una kasing ginawa sa kanya is dito dinaan. Hindi ko alam ang pangalan. College pa kasi ako noon eh.
Bronchoscopy.
Oo, dito sa Bohol.
Sa-
Ngayon, dumaan ng ilang days, wala yung result. Nung pinuntahan ng mama ko sa hospital, nilagay lang para nila sa ref. So sabi ni mama, hindi na yan accurate paglalabas yung result. Kaya dinala niya sa Cebu. Ayaw nang magpagano ng papa ko kasi masakit daw. Kaya binayopsi siya dito para sa gilid, dinaan. Ganon.
Di karayom.
Oh, karayom na mahaba. So, pag-uwi,
Biopsy
sabi
sa
ng,
lungs. Biopsy sa lungs.
oo, biopsy sa lungs.
Okay.
Pag-uwi, yun ang napansin ni mama pag-uwi, hindi niya na madala yung bag niya. Pagpunta nila ng Cebu, kaya pa niyang dalhin yung bag niya. Pag-uwi niya, hindi na. Monday sila pumunta, umuwi ako ng Saturday kasi estudyante pa ako noon. Pag-uwi ko, nagtaka ako kasi hindi niya na maano yung kape niya. Sabi ko, anong nangyari kay Papa? Ba't parang hindi na magalaw yung kabilang katawan niya? Sabi niya, ganyan siya nung pagkatapos ng i-biopsy, pag-uwi nila.
Okay. Sige, analyze ko. I will try, ha? And then after that, ano nangyari? Bumalik?
Ano kasi pag labas ng result, stage 4 cancer na siya.
Okay. And then, yung kamay niya, yung...
Tuloy-tuloy na yun na hindi niya na magalaw. Tas, nasa bahay na siya na kami mga anak sinet na ng mama namin na stage 4 cancer yung papa niya, hindi na siya magiging okay, ganon. Hanggang sa nag-treatment na siya. Ano ba yun yung... ano ba yung mga treatment? Yung isa, radiation.
Radiation. Okay.
Oh.
Okay. So, yung kamay niya, hindi na naka-recover.
Hindi na. Para na siyang na-stroke, Doc. Maglakad yung half ng katawan niya.
Okay. So, one possibility, kasi right after the biopsy, di ba? Yung nangyari, yung weakness ng kamay niya.
Oo.
Right after, di ba?
Oo.
Soon
Pagkatapos,
So, anong hindi
so,
natin alam kung ganong usually naman theoretically kung yung mga karayom na pinapasok doon, baka may natamaan na ugat, no? Pwede rin, no? Okay. Pero bihira 'yon, no? Kasi usually Cebu palagi ko may under baka CT scan guided yata yung biopsy niya eh, no? Tama? Hindi mo alam.
Siguro, hindi ko rin alam.
Okay. So one possibility, baka during the biopsy, baka natamaan yung isang baka nasagasaan isang ugat, no? Yung nerve, hindi niya
kasi
magalaw yung kamay niya, yung kanan, doon sa side na biopsy, di ba? Tama? Hello? Naghang.
Daw.
Hello?
Yes po. Naririnig niyo po ako?
Naririnig kita.
Oo, sa
side, the same side, di
sa
ba?
side. Yes po.
Okay.
Same side.
Okay. So baka may baka part of the procedure, baka na
Oo, siguro.
Okay. And then kasi kung spread siya, hindi kaagad, no? Usually mga weeks, no, months, no. Okay.
Kaya doon napasok yung mga assumptions na pag biopsy, mag-i-spread agad. Mag-i-spread, oo.
Yeah.
So, yan yung nangyari din dito sa akin nung parang ni mama na wag ipa-biopsy. Ako naman sa side ko, parang gusto ko kasi para kung cancer, edi cancer, yung gano'n, para malaman din ang hindi kasi hindi ko din malalaman ko pag hindi ko pina-biopsy.
Yeah.
Yung
Yeah. Kasi kung minsan hindi mo pa-biopsy, gusto mo ba pa-opera na lang, di ba? Kung minsan baka hindi mo kailangan ng operasyon, di ba? Ganon.
Oo.
So yan ang mga issues na dapat i-consider, no?
Oo.
Okay. Thank you for
Okay, yun lang po.
sharing. Aloy.
You're welcome po. Thank you po, Doc.
Okay. Any more who wants to share? Maganda yung mga sharing. Any consultations that you want to have with me? Kung wala na, we'll call it a day. Wala na, last call. So we'll have next topic. I might be talking on hypertension kasi very common in hypertension, na? Next week. More on medical. Pero very common kasi yung issue ng hypertension, na? Okay. Okay? So, okay. Let's call it a day. Goodbye. We'll see each other next week.
Thank you,
Thank you,
Doc.
Doc.
Bye-bye.
Thank you, Doc. Happy weekend.
Happy weekend also.
Po.
Thank you, Doc.
Bye-bye.
Bye.